Hello, everyone. Thanks so much for joining us. We're here live to talk about coronavirus vaccines and answer your questions. So I'm Faye. I work in the research team at Diabetes UK, and I also have type 1 diabetes myself, and I'm eagerly awaiting my vaccine invite. And I'm joined by a wonderful panel of experts here who I'm going to be putting your questions to. So some introductions. We have Dan Howarth with us, who is our head of care at Diabetes UK and a diabetes specialist nurse. We then have Dr. Lucy Chambers, our head of research communications at Diabetes UK. There she is. And finally, we're so pleased to be joined by Dr. Bhasha Mukherjee, who is a junior doctor at the Royal Derby Hospital and is also a big supporter of our charity. Hello all, and thanks so much for being here. So we've got you for the next 45 minutes or so to answer everyone's questions about coronavirus vaccines. And we already put a call out for questions and have had a lot sent in that we'll kick off with. But for everyone who's watching, please do add any of the questions to the comments here, and we'll do our best to get through as many as we can while we're live this evening. Any that we don't get through, we will make sure to come back and get answers to you. Okay, so we better kick off. And Dan, I'm going to come to you first, if that's all right. So we have a question from Hazel, who asks, why is it so important that people with diabetes get their vaccine?
Really good question, Hazel. Thank you for asking it. It's really important for everybody to get the vaccine. I think there's no denying that. I think it's really important for people with diabetes, though, because over the past year, we've seen a disproportionate amount of people with diabetes being negatively affected by COVID-19. The statistics were really shocking last year. And so if we've got a way of protecting ourselves against this virus, then that's what we really need to do, everything that we can to do it. And the best way, alongside all of our social distancing and hand hygiene, is to have the vaccine. Similar thing to why we encourage people with diabetes to get the flu jab each year. It has some very not nice consequences and sometimes sadly leads to death. So getting the vaccine, ensuring that you're well protected and kept safe.
Thanks, Dan. I've had another really key question come in from Henry, who asks, is the vaccine safe for people with diabetes? Lucy, can I come to you for that one?
Sure. Hi, Henry. Thanks for your question. So as Dan was saying, we know that diabetes makes people really vulnerable to getting seriously ill from COVID. So really, to keep people safe, people with diabetes safe, we need to make sure they're getting the best protection from the virus, and vaccines are the most effective way to do this. So we can be really reassured because in the UK, we have extremely strict controls in place to make sure vaccines are safe. So first of all, they have to go through a series of clinical trials with increasing numbers of people to test whether they're, first of all, safe and then effective. And once these clinical trials are complete, then there's an independent agency in the UK called the MHRA, don't ask me what that stands for at this moment in time, that looks at all this evidence from these clinical trials to make sure that the trials are of the very highest standards. And once they've assessed all the evidence and approved the vaccine, we can be extremely confident that the vaccines are safe and effective. I think it's also really reassuring to know that in these clinical trials, we know that people from all diverse backgrounds, from all different ages, men and women, different ethnicities, and with a range of health conditions have been included in these trials, including people with diabetes. We know people with diabetes have done well in the trials.
Thank you, Lucy. That's really reassuring. Dan, one for you. That's a question from Jess. What side effects can I expect?
Jess, as with most vaccines, there are some very common... Oh, I disappeared. I hope I'm back. Jess, yeah, side effects are very common side effects from having a vaccine. And if you've ever had a flu vaccine or any other type of vaccine, then you'll know those ones that they tell you about when you have it. But common side effects from the COVID-19 vaccine is that you can experience a sore arm. You might get a slight fever, a headache. You might feel a little bit lethargic. And for people with diabetes, you might notice that your blood sugars mildly raise a little bit. Now, these should all settle down within 48 hours, really, 72 hours at the most. And if you don't, you should go and speak to your GP about it. If you've ever had an allergic reaction to other vaccines, then it's worth pointing that out when you go and get your vaccine. But because it is a very new vaccine, we don't really know how it will respond to you if you've ever had an allergic reaction. So just be a little bit more careful. You can use normal things that you would normally do to help with a fever or headaches, and that's paracetamol, really, if you can take that. But again, if you experience that for longer than 72 hours, speak to your GP.
Thanks, that's good to know what to expect. And I can see some comments coming in on the chat of people that have already had vaccines and saying they didn't have any side effects or just had really mild things like a headache and sore arm. So that's good. Pasha, I'm going to come to you next with a question from Harry. He says, what advice would you give people who aren't sure whether they should get the vaccine?
Hi, Harry. Thank you for your question. I would say do your research. The Gov website is really useful to get lots of answers, and also the NHS website as well. Look at verified sources for your information. There is a lot of misinformation going around, especially in the BAME community. There's a lot of gossip as well. Just get your clarifications from verified sources. You can, in fact, write to us, Diabetes UK, to get clarifications if you want as well. Yeah.
Yeah, thanks for the plug, Pasha. Yeah, and we have the link in the chat to our website page on vaccines, which gives you lots of great information as well. Dan, coming back to side effects, we've had another question on that from Maureen, who's asking where the side effects might be, whether people with diabetes might have more chance of getting those side effects.
Thanks, Maureen. There's nothing really that would suggest that people with diabetes will get more side effects or will have an increase in the amount of side effects that they get. People with diabetes might have a slightly different side effect of their blood sugar rising. Now, everybody who has the vaccine might have their blood sugar rise, whether they've got diabetes or not. But as Maureen probably knows, and a lot of us out there, when our blood sugars rise and we have diabetes, our body isn't able to automatically do something about it. So keeping an eye on our blood sugars and testing, being a little bit more careful about the kind of stuff that we're drinking as well. So drinking plenty of fluids when our blood sugars rise slightly. And this is all part of the body's way of protecting itself and working alongside the vaccine in order for it to do its job. So it's absolutely normal, and your blood sugars shouldn't be going sky high. They should just be peaking a little bit. As Faye mentioned that she had diabetes, I've got type 1 diabetes, and I had my vaccine this afternoon, and my blood sugars went to around 13, and I couldn't figure out why. And I thought maybe it was the stress of that, maybe it's the vaccine. But I'm sure other people will let them in the comments below tell you what happened to their blood sugars. But that's the only real side effect for people with diabetes that's slightly different to the rest of the population.
Thanks, Daniel. We had lots of questions specifically about effects on blood sugar levels as well, but I think you've covered that wonderfully there. So we're also getting lots of questions in about people that haven't had their letter yet and are worrying, is that normal? Will they get it soon? Dan, would you be able to shed some light on that?
Yeah, sorry, the question is whether they've not had the letter yet and should they be getting it soon?
Haven't had the invite yet, yeah.
Okay, yeah, so it depends where you're based, where you live, really, or where your GP's based. Some people will be getting letters from central NHS. Some people will be getting it from their health board or their GP to tell you how to book on. Some people are also getting text messages. So if you see a text message from the NHS that says click here to book an online appointment, then do that. It'll ask for your postcode, and then it'll tell you where your nearest COVID vaccine centre is. Now, there's many places across the UK have been set up specifically for the COVID vaccine, so you might not have to go to your GP surgery, but then again, they might become a COVID centre themselves, so you might be going there. It really very much depends on where you live and what the protocol is around your area. Sadly, it's so different that I wouldn't really know where everyone is to do. Hope that answers it. Does that answer it a little bit, Faye?
Yeah.
Yeah.
And there's lots of us, aren't there? There's about 4 million people in the UK with diabetes. In that group 6, there's about 7 million people. So they are going very quickly, but we do have to just hold on and be patient. I know I'm like leaping for my phone whenever I see a text or a call. I'm like, this is it. Got the invite, but hasn't come for me just yet. So yeah, I'm hanging on in there.
It will come.
Okay, there's also a lot of questions coming up about kind of children who are in that 16 to 18 range, and also some questions about children under 16. So Sean has said, my son is 16, diagnosed with type 1 9 months ago. Our GP aren't vaccinating under 18s, they've told Sean. Can you explain why 16-year-olds and over can't have their vaccines yet, when it states on some kind of advice that Sean's seen that if you're over 16 with underlying health problems, then you should be in this priority group 6. Dan, that's another one for you. Very popular.
Yeah, no, you're right. Thank you. I quite like the sound of my own voice. Lucy, I'm sure, will tell you that that's the case. So, yeah, I'm happy to answer. Yes, you're absolutely right, Sean. And I'm really sorry that your GP has told you this. That's probably just a your GP practice. That's just their policy. COVID vaccine centres will be doing people from the age of 16 upwards. That is, the people who are over 16 with an underlying health condition such as diabetes will be seen in this stage, this round 6, group 6. So you should be getting them. If you're Sean, if I was you, I would either get in touch or go onto the website, on the NHS website, and find out to book your appointment or your son's appointment, and then you'll be able to get somewhere, hopefully, that will say to you, yes, they do over 16s. But you're right, people over the age of 16 will be getting offered a COVID vaccine.
Thanks for clearing that up. We're going to go to someone else. Pasha, we've got a question from Sheila. So she said her GP isn't doing vaccinations, so will she get called up by someone else?
Hi, Sheila. Thank you for your question. So you can get contacted not just by your GP, but NHS as well regarding the vaccine. And Dan did cover this earlier briefly. So you can get a text, you can get a letter. And actually, if you feel that you are you do fit the criteria, and you can, again, look at the criteria on the gov.co.uk website. There's a really long list of criteria. Essentially, you just need to be clinically vulnerable and or be a healthcare worker, and there's several other criteria basically, and you can actually book yourself the vaccine. Again, on the NHS website, it does give a link for you to do that. I found it really easy to find that information. I just googled COVID-19 vaccine NHS, those few words, and that was enough. You can get all your questions answered that way as well, about whether you're going to be getting it soon and how to as well.
Yeah, so I think you can book on the website if you're over 65. I don't think they've opened that up yet for people with diabetes in group 6. I don't know if Dan has any. Am I right?
Yeah, they as of this weekend they have actually phone. So you can, yeah, they experienced a lot of people over the weekend trying to click through. So, and they did release a statement at the top of the website to say we've had a lot of people, so don't panic, we're refreshing this, we're updating it. So as I'm aware, as of the weekend on Saturday, it was saying that you are able to still book your own, as long as you fit into, as Pasha said, one of those, the criteria for now. Yeah.
Oh, interesting. Thanks, Dan. Okay, Lucy, Ali has asked, do we know what the vaccines are made of and if they're halal?
Hello, thanks for your question. Yes, we do know what the vaccines are made of. When the complete list of ingredients will be on the patient information sheet that you should receive or can ask for about the vaccine. But what we know is that most of the vaccine is just water, basically. It's the main ingredient. There'll also be some preservatives, some stabilizers. So this could be salts and sugars. Some of the vaccines, I think it might be the Pfizer one, but don't quote me on that. One of the two contains a tiny amount of alcohol, but really at tiny, tiny levels, about smaller than what's in a banana. And then there'll be the ingredient, which is actually what causes the immune reaction in our body. So like the blueprint for the virus, and then some other very small bits and pieces. So there is no animal products in the Pfizer or Oxford vaccine, and both vaccines are supported by the Muslim Council of Britain, so they're considered halal.
Thank you, Lucy. I'm going to go to a question from Bethan, who asks, do you need to take extra insulin if your sugar goes up, presumably after you've had a vaccine? Dan, can you take that one?
Yeah, it depends. Was that Bethan? Thanks, Bethan. It would really depend. I mean, if you are comfortable doing your own corrections and that's something that you normally do, as part of, if for example, you've been Daphne trained, then that's something that you would do. Yeah, you could do. Remember, it would be a short-term stress hormone response as well. So if you are thinking about increasing your insulin, it'd probably be better to take a correction dose rather than increasing your day's total daily dose. But if it goes on, again, if your blood sugars are going high and staying high after you've had the vaccine, then it'd be worth either speaking to your diabetes nurse, your GP, or your diabetes doctor, just to see what you might want to do with probably with your basal insulin, or you might need an adjustment in your ratios. For people with type 2 diabetes who don't often, but it's not impossible for them to do corrections or adjustments with that kind of insulin, it's probably best just to wait for it to come down and see what happens. Again, it's going to be a short period of time. And if your blood sugar is slightly high because you've had the COVID vaccine for a day, 2 days, the overall effect on your HbA1c will be rather minimal, really. It's about making sure that it's not constantly high. So we can understand, we know why the blood sugar has gone high. That's a good start. And it's not like we'll be having a vaccine every single day. It's not like eating cake or for breakfast or something like that, which means you can figure it out. It's just that you've had that vaccine, give it a couple of days to settle, and then carry on. Things should get back to normal.
Good advice, thanks, Dan. Pasha, I have a question from Hazel. So she asks, if I've had severe reactions to vaccines in the past, can I get my jab in a hospital rather than local temporary setups?
I'm going to have to redirect this to Dan because it's a very specific question. I would say, though, that after the vaccine, there is a period of assessment that is done in every COVID centre. And they do have an on-site sort of first aider. So with regards to whether you'd prefer to be in a hospital or not, I think I'm going to have to send this to Dan, I'm afraid.
Thank you. Yeah, the answer is if you've had a particular severe reaction to any vaccine and you're worried about this, then you should speak to your GP about it and ask that you are specifically seen in a particular place. Now, some of these COVID vaccine centres can be part of a hospital grounds, so you're in hospital vicinities, but some are in just makeshift centres. They're fully trained members of staff. So people who are doing the injections have been fully trained. There is medical professionals on site as well. So let's have some faith in the people that are there. But it is your right to choose to go somewhere else. And if you feel more comfortable, speak to your GP or your diabetes team at the hospital and say that you would much rather, it would probably help your anxiety levels as well, and in turn your blood sugars, to be seen somewhere where you want to be vaccine. You might have to wait a little bit longer if there's a queue, so to speak. You might have to wait a little bit to get into that place that you want to go for your vaccine. But yeah, you can ask whether your GP should support it, and if not, then go into your GP maybe and see them. Yeah.
Thanks, Dan. So a question about what we can expect when we're actually going to get the vaccine, if I can come to you, Bhasha. John's asked what safety measures are in place at vaccine centres, and will he be safe?
So vaccine centres have actually got to get approval from a regional and a national board before they are approved safe for vaccinations. And they do need to get a site inspection done before they're active to the public. And just like any other healthcare setting right now, we do have social distancing measures. You will have hand gel facilities. Everybody that's going to be working there is going to be in PPE, especially the person who's going to be delivering the vaccine. They're going to be in PPE as well. So actually, again, you can have a look on the internet for the full list, because they have a really long list of everything that, is there in place for you. I say the internet is our best friend sometimes with information like this. You can really do your full research. If it is from a verified source, then you can see the full information. But yes, from my experience, it was socially distanced, and I got a set of leaflets giving me the forewarnings of everything that might be coming up. Everyone was wearing masks and face shields as well. So I felt really safe in that environment.
That's very good to know. So, Lucy, I'm going to come to you. We've got a question from Yvonne, who asks, can we trust vaccines when they were developed so quickly?
Thanks, very good question. I've been asked it quite a few times. I know there's a lot of questions about why this has happened so quickly. I think the first thing to acknowledge is that the whole world and the best brains in the world all got together, the best scientists, government and pharmaceutical industries, really in a huge joint effort to try and get us vaccines that are effective and safe. And they've managed to do that. So it's just really, everyone was so motivated to do it. There were a few specific things why this has been able to happen so quickly. The first is that the technologies used to develop some of these vaccines, which are very new technologies, were developed before the pandemic struck. So, for example, the technology used to develop the Oxford vaccine was the same technology that was used for the Ebola vaccine that's in use currently. So it's not like scientists had to start from scratch with the science. They'd already done a lot of the work. Also, what happens with research and science, especially clinical trials, is that the majority of the time is spent doing all the kind of administrative stuff, like getting funding, getting in front of an ethics committee, those sorts of things. Because this was so vitally important to get things moving so quickly, a lot of that red tape was cut, and people were fast tracked, so people didn't have to go through the funding rounds and all that sort of stuff. So scientists could get on with the science basically and do the research. And also what happened was manufacturing of the vaccine happened early as well, before they were approved, with the idea that if they were approved, they'd be ready to go, which is what happened. So I can just assure you that no corners were cut in the science and the clinical trials. All the normal processes were taken, and all the normal numbers of people, actually more people than usual, took part in the clinical trials. So really a celebration of scientists, I think, about how we got there so quickly.
Yay, science! And we don't even just have to look to the clinical trials now. Like, these have been given to millions of people in the UK and worldwide. So we have more confidence looking at what's actually happening in the real world as well. I'm aware that I can see a lot of questions coming up and a lot of comments about shielding. So we are going to kind of answer those afterwards, but we'll try and get through the questions more about vaccines right now while we're still live. So a really great question from Ruth here for you, Dan. She asks if there's any kind of prioritising going on within Group 6. So are GPs working through diabetics in any order, for example, worse HbA1c or age, anything like that?
Yeah, very good question. There's a lot of people to get through in group 6. We know that. So it's the remainder of the age group and the over 65s, I think it's 60s or 65s, and people with diabetes. And it's a really good question because risk is so independent, and we spent a long time last year thinking about risk and risk factors, and it is so individual on your circumstances yourself and your past medical history and even your genetics and stuff like this, that it's really quite unfair, I suppose, to just say all people with diabetes need to get done. We should be doing the people who are most at risk, and that's what's started to happen. You might have seen that in the press, or you might have seen from our websites, that we were asking the CMOs across the nations to prioritize some people with diabetes who are at even more of a risk than other people with diabetes. And from that, we think it's generated their response to use what's known as the Q-COVID risk tool. And that's been used by the computer systems across the health service to find out who have got the risk factors, whether that be diabetes or something else, and have them also seen during this stage 6. So yes, in answer to your question, very simply, there is a prioritization going on for people with diabetes as well. The very first priority had to be people with age, the people, more senior people. So the over 80s, I think, was the start, and then the 75s, and then the 70s. And that's because their risk factors were their risk was so much greater than everybody else's, with and without complications of diabetes. So having a particular focus on those certain risk factors meant that we can get the vaccine to people who need it before other people who also need it. Did that make any sense? Faye, I rambled
Perfectly.
Did it make sense, that?
It always makes sense, Dan. No, that was very good. Thank you.
Thank you.
So a question from Hev, who asks, will the injection react with other medications, for example, SRIs? Dan, do you have any thoughts on that?
Yeah, no, most vaccines are relatively safe when in terms of what they the complications that they can cause on other medications, and it's very safe. We've not seen anything in research that says if you're taking certain medications, I think that they will ask you about, definitely not your SRIs, they'll ask you about anticoagulants, so things like aspirin, if you've been taking aspirin. You might speak to your GP, who would suggest that you stop taking a certain medication beforehand, but that would be very, very specific. I think there are some cancer drugs that might need to be withheld or at least delayed. But yeah, no, it's a very safe to have in terms of contraindications with other medications. So I might ask Lucy, there's nothing from the research, is there? I mean, Lucy knows the research much better than I do. I'm just asking her.
No, nothing springing to mind about, interactions with other drugs, and you wouldn't expect it either from the kind of biological way that vaccines work as well.
Thank you.
Thanks, guys. We've had a lot of questions about pregnancy and whether women with diabetes who are pregnant should have the vaccine. So Lucy, maybe you could kind of start off with telling us what we know from the research and whether vaccines have been tested with women who are pregnant.
So my understanding is, and Faye, please correct me if I'm wrong here, because I know things have changed a bit, that pregnant women didn't take part in the clinical trials. There's not data on this as such. So first of all, the government was saying pregnant women, not that there's any data to show it would be dangerous or risky in any way, but because the data wasn't there to show it was safe, it's best not to take the vaccine in pregnancy. However, things have evolved. The government's changed their position a bit now. And what they are recommending is that women who are pregnant, who have an underlying health condition or any characteristics or factors that put them at increased risk of severe illness from COVID, that they have a conversation with their healthcare team who are looking after their pregnancy to see if they should get the vaccine or not. So it's down to individual decision. Dan, I don't know if you have anything to add there.
No, that's absolutely what the Royal College of Obstetrics and Gynecologists are also saying, that if you are pregnant and you have if you have diabetes, then have a discussion. They would suggest that it be safe, but it's up to you to have that discussion as well. So, yeah.
Yeah, good point. I didn't mention that the underlying health conditions the government considers diabetes to be one of them. So type 1, type 2 gestational in pregnancy can put you at increased risk of serious illness from COVID, so you may want to consider a vaccine.
Thanks both. Okay, next question from Nikki. She says, hi, I have brittle asthma and type 1 diabetes. How safe is the vaccine for me, as I am prone to intubation when my chest gets bad? Dan, could I come to you on that?
Yeah, so Nikki has asthma and type 1 diabetes, and she's prone to incubation when her asthma gets bad. Firstly, I think the COVID vaccine, you will be prioritized to get that, and you should get it in. You should get it. The thing about the needing intubation when your asthma gets bad is that there's nothing really that would suggest the vaccine will cause your asthma to get bad. Only the usual things that are around at this time of year that might cause your asthma to get bad. I mean, what in the past, when you've needed to be intubated, what was it that caused your asthma to exacerbate or to kick off? It wasn't a COVID vaccine, because this is the first time that we're having it. I'd have some faith in the vaccine. Obviously, you would know yourself that having asthma will put you at an increased risk as well, particularly if you've had severe asthma in the past, and having diabetes increases your risk. So I would say that getting the vaccine would be the best thing for you, because that will reduce your risk of potentially having severe complications from COVID. Yeah, but good luck with that. I hope everything works out for her.
We've also had, I know you've already talked about blood sugars, Dan, but we've had quite a few more questions coming in on that, and people who are worried that they could go into DKA, and sugars could really go out of control. So I don't know whether if you can just kind of come back to that and, provide a bit more reassurance, maybe, if that's appropriate.
Yeah, absolutely. So yeah, going into DKA after the vaccine, again, nothing has been said that people with type 1 who have the vaccine will have high blood sugars enough to cause them to go into DKA. And what I would be questioning is if that was a fear of yours, or a genuine, generally concerned about going into DKA. I would look at what's causing that. If your blood sugars are normally at a level that's close to being in ketosis or developing ketones, then before you go for the vaccine, you might want to really focus on bringing your blood sugars down, as difficult as that might be during this worrying time. But the vaccine itself should not be causing your body to go into DKA. If you have had DKA in the past, all type 1 should really be given the means to test for ketones. So if you notice your blood sugars are going over 13 if you're on a pump, or over 14 if you are injections, then test your ketones as well, and stick to your 6-day rules. This might be a time, in the past year, we speak a lot about 6-day rules and managing your diabetes when you're not well. Well, actually, this would be really handy to know for when you go for the vaccine. And if it does cause you to be a little bit under the weather, you can implement those 6-day rules. So have a bit of a refresher from them, maybe later tonight on our website, just to find out what it is you need to do. But generally speaking, it's testing your blood sugars more often, testing your blood ketones if you need to, drinking plenty of water, and avoid missing your medication, particularly your insulin. Don't omit your insulin because you feel unwell. And all those things should prevent you from developing DKA, if that's something that you are particularly concerned about. The vaccine itself shouldn't.
Thank you, Dan, and thanks for the reminder on 6-day rules. It's always good to kind of make sure we're familiar with those. Let me see, what have we got next? This is an interesting question. Can you get the vaccine in your Libra arm, from Tracy? Dan, can I come to you on that?
Yes, you should be able to get your vaccine in your Libra arm. They will probably avoid it. So if you generally, when we give vaccines, we will ask which is your dominant hand, which do you write with? And if they will go into your opposite arm. So I'm right-handed, they'll go into my left arm. Now, if I had a Libra sensor there, they would go to the right arm again. So they'll avoid it just because it makes sense to. We're sticking a needle going into your muscle. Remember that. So it's going into your muscle. So we're really going to avoid any problems with it. There probably wouldn't be any problems, but seeing as there's little evidence to say that there is, there's also little evidence to say that there isn't. So they'll avoid it and go to your other arm. If you wanted to change your site, if you wanted to make it so that you changed your site afterwards, then you could, try and avoid the site where you've gone in. But generally, you'll be going along the kind of the midline of the arm for the injection, which is where your site probably sits. So it can go in your arm, they just probably won't.
Thank you, Dan. We've got another question, I can't see who it's from, but saying that they were diagnosed only 4 weeks ago. Will they be missed out? I don't know, either Bhasha or Dan, if you want to come in on that.
I'll pass this over to Dan again. Sorry. Are we talking about diabetes, diagnosed with diabetes?
Yeah, that's right.
Yeah, I'll answer this one. Yeah, so sorry to hear that. Did mention if it's type 1 or type 2? It doesn't really matter. Just out of curiosity. Sorry to hear about your recent diagnosis. I hope that you get a lot out of Diabetes UK and all of its educational things that we've got on the website. Good question. Will you be missed off? Well, the way that people get sent these appointments is through a coding system. Now, coding is done right across the NHS in all 4 nations by a couple of different systems. And what it means is that your GP types in, Dan Howarth has got type 1 diabetes, and he codes me with a particular code that says type 1 diabetes. So if your GP has gone proactively onto your system, which he probably has within 4 weeks, and typed in, you've got type 2, type 1 diabetes, then you should still be getting a flashed alert to say, send out an appointment. If you're worried, you can get in touch with the GP and say, just to make yourself aware, they're giving you, it's your vaccine that you're after. So get in touch with them and say exactly what you've just asked us, but you should be okay, given that it was 4 weeks ago. And, particularly if you've had a prescription for your diabetes, for anything that you've needed for your diabetes, then there will probably be a code that's already in the system.
Thanks, Dan. We've got another question from Louise about what's going on in the different nations of the UK. Dan, can you provide any clarification on what we could expect in Wales, Northern Ireland, Scotland?
Yeah, at the minute, all nations should be giving appointments to people with diabetes right across the nations. I'm aware that Northern Ireland have been doing such a fantastic job of rolling out the vaccine that a lot of people with diabetes they're almost done, the people with diabetes. What I can say, so I wouldn't be able to tell you when the date is that they will start giving that, but all nations are expected to have given the vaccine to people with diabetes by the end of April. They're expected to. So I don't know, if you get an appointment for the 1st of May, don't shout at us and say that I was making it up, but by the end of April, it's hoped that all 4 nations will have given people with diabetes their first, or offered the first jab to people with diabetes.
Lucy, I've got one for you from Zay. So she asks, why do we use different vaccines, e.g. AstraZeneca and Pfizer?
Hi Zay, thanks for the question. This comes down to the government's strategy to make sure we had some vaccines that work. Basically, they were hedging their bets. So the way the vaccines were developed, basically it was a race. There's lots of pharmaceutical companies working to develop vaccines. And at that point in the pandemic, early on in the pandemic, obviously the government didn't know which ones would be successful or not. So they pre-ordered big batches of all the promising looking vaccines with the hope that they would be approved by the MHRA, the independent agency that assesses drugs in this country. So what has happened is that three now have been approved. 2 are actually being used. So that's the Pfizer one and the Oxford one that was produced in partnership with AstraZeneca. So the government actually bought those before they'd been approved with the hope that they would be approved, and they work, and we're now using them. There's a third one which is just very recently being approved. It's the Moderna vaccine. And I believe that will come into circulation for use in spring. So really, the government just took an approach where we know lots of companies are working, trying to produce an effective vaccine. We don't know which one will get there first, but we want to vaccinate the country as soon as possible. So they hedged their bets and basically pre-ordered lots of different ones with the hope they'd be approved.
Yeah, I mean, we're being spoilt, really, the fact that there are so many different vaccines on the table. So we're going to have to start wrapping up in a couple of minutes. So this might be our last question, which is going to go to you, Dan. It's from Katie, who's asked, do you have the same side effects with the second dose of the vaccine? I had the first yesterday and was unwell, and now I don't want to get the second dose as I'm too scared I will be so unwell again. What's the chances of the second being as bad?
Really good question. Sorry, Faye, what was the question person's name?
Katie.
Katie. Okay, so Katie had a first jab yesterday, has been really unwell with it. Okay, I was really sorry to hear that, Katie. One of the reasons why we become unwell or we get some certain symptoms when we have a vaccine is because that we are sticking in a needle into a muscle in our arm that the body doesn't expect. So even if you inject insulin with a very small needle, your body's got used to that and doesn't need to throw out what we call an inflammatory response. It doesn't need to send out these white blood cells to go and have a look at what's going on. So potentially your second jab might come along and have maybe a little bit of swelling or a little bit of a headache and not be as unwell as you say that you have been over the past 24 hours. That potentially might happen, and it does happen with other vaccines that we have to do in stages or other different medications that need staging out. But it'd be difficult to say about this one. My advice to you, Katie, would be to talk to the practice nurse or talk to your GP about it. It's best to absolutely complete the course of this vaccine, having the 2 shots. I understand that it's not made you very well, but it's doing a really good job deep down inside. It's protecting you from this horrendous virus that we definitely don't want you to get. So give it another go. You know, you might feel a little bit better by tomorrow. Like I said, within 72 hours, those symptoms of being unwell should have gone. Plenty of rest, plenty of water, some paracetamol if you usually take it. And yeah, then give it another go maybe.
Yeah, we hope you feel better soon, Katie. Okay, well, I think we're going to have to end it there. Lusa, Dan, Pasha, any other thoughts before we go? Any kind of final messages?
Have your vaccine when you're offered one.
I've
got mine on Thursday and I'm excited for it.
I've learned a lot.
I spoke over you then.
Sorry. Yeah, just take the vaccine.
Yeah, that's it really. So thank you so much.
Check out our website. Go and see our website. We've got lots of information about coronavirus, and we've got lots of information about the vaccine as well. And there's other places. Again, refresh yourself on the sick day rules. And yeah, and Pasha kindly mentioned about reputable websites. I would class diabetes.org.uk as a reputable website. So get yourselves in there to have some a look. Thank you all.
Thanks so much for your time, guys. That's been incredibly helpful, you've helped reassure us over so many things and clear things up. And thank you to everyone who's been listening and sending in their questions. We know there was a lot that we haven't managed to answer, particularly a lot around shielding, and we will come back to those over the next few days and make sure you get responses. And as Dan said, there's a link to the vaccine page on our website in underneath or above this post, and from there you can find lots of other information on coronavirus, and a reminder that our helpline is here for you as well, and the number for that is also in the post. So we'll leave it there and we'll say goodbye. Thank you so much, everyone.